there, this is Melissa. Today we're going to start a series on hip popping, which is a very common issue in dancers. There's lots of different kind of hip popping, so what we're going to talk about is just general things that would help either of the hip popping. Most dancers either get it in the front here, especially with grand battement front into the side, and also sometimes you'll get a snap over the side of the hip, which can be different things. So we're going to talk a little bit of technique today, mostly for the supporting leg, and then the next time we meet we're going to talk about the working leg. So one of the things we want to talk about is over tucking. We talked about it a little bit in our turnout series, but when you over tuck the pelvis, which is very common with ballet dancers, is you overstretch the front of the hip. So people tend to be loose in the hips anyway, and this causes what I'll call increased play in it, like if you have play in your steering wheel. So when you over tuck the bone in the socket, it's gonna stay in the socket, but just for these purposes, but it's gonna push forward. And what that does is it overstretches the tissues here. So a lot of times you'll get pain in the front of the hip. I used to pound my hip like this when I was dancing because this was my bad hip all the time. So you really wanna be careful that you don't over tuck. So what I like to tell dancers is when you're standing, think of your sit bones going straight to the floor. You really want your tailbone to go directly to the floor. So if your tailbone is coming forwards, you've gone too far. And if you've danced for a long time, it will feel natural to you. And if you get up out of that over tuck and get flat through the front, you will feel like you're sticking your derriere out a mile. So you're gonna have to get in front of the mirror and kind of play with it a little bit. You can also use your hands if you put them on the front of your hip bones, and if you're comfortable putting on the pubic bone, it's actually two bones together, but that's a whole nother story. And you wanna make sure that your fingertips are pointing directly to the floor. If you over tuck, you can see how now my fingertips are slightly in front of the tops of my hands, so I'm in that over tuck position. Again, overstretching the front of the hip, which we want to avoid. So get your lift through the pelvis, so you all know about pull up and pulling the ribs in, and so now you're placed here. The second thing you want to watch is what is your supporting hip doing. A lot of times when we work, that hip is moving, which is going to overstretch it as well. So as you do anything to the front, you've got to avoid the habit of pushing forwards here. This should not be a stretch position. This should be a held position. So I like to tell dancers, feel like this is a cement wall, it doesn't budge, and now this leg is gonna move just on its own. So this leg is staying tall, and we're not shifting the weight forwards on this leg, we're keeping the weight over the ball of the foot. And then when you go to the side, same thing, don't pull off the leg. That one's a little bit easier. We all know there's supposed to be no weight on the toes, but keeping this hip bone lifted up, so we're lifted through the front, out to the side without any movement in the supporting leg. So stay tuned, and we'll do a little bit more technique next week.